Nipah virus, a global health threat the world is still unprepared for. On January 25th, global health experts issued a warning that the deadly Nipah virus could develop into a future pandemic, as the fruit bat species Pteropus, known to carry the virus, has now been found across many regions of the world. The Nipah virus was first identified in Malaysia and Singapore in 1999. Since then, it has caused several outbreaks with an extremely high fatality rate, ranging from 40% to 90%. Over time, the virus spread thousands of kilometers, reaching Bangladesh and India. Despite being listed by the World Health Organization, WHO, as a priority pathogen, there is still no approved treatment or vaccine available to protect against Nipah. According to Reuters, India experienced a serious Nipah outbreak in Kerala in 2018, which resulted in 17 deaths. The incident raised concerns about the country's vulnerability to emerging infectious diseases. 27 years have passed since Nipah was first discovered, yet the world remains dangerously unprepared to face this global health threat, said Richard Hatchett, Chief Executive Officer of the Coalition for Epidemic Preparedness Innovations, CEPI. CEPI was established in 2017 to support the development of vaccines against emerging infectious diseases. One of its earliest priorities has been the Nipah virus, due to its high fatality rate and pandemic potential. Nipah typically spreads to humans through infected pigs or fruit bats, particularly when people consume food contaminated by the virus. However, experts warn that the virus can also spread directly from person to person, increasing the risk of wider outbreaks. So far, Nipah outbreaks have been limited to South and Southeast Asia, Hatchett explained. But the virus has the potential to become a pandemic because Pteropus bats are found throughout tropical and subtropical regions, home to more than 2 billion people worldwide. He also emphasized that human-to-human transmission makes densely populated areas especially vulnerable, raising serious concerns about the virus spreading beyond its current regions. WHO and CDC on Nipah virus. Who is at risk and how dangerous is it? The World Health Organization, WHO, and the U.S. Centers for Disease Control and Prevention, CDC, have both warned that the Nipah virus poses a serious public health risk, particularly in regions where the virus is known to circulate. According to WHO and CDC, Nipah is a zoonotic virus, meaning it can spread from animals to humans. It belongs to the Paramyxoviridae family, under the Henipavirus genus. The virus can be transmitted from infected animals such as fruit bats and pigs, or directly from person to person. The primary natural host of the Nipah virus is the fruit bat of the Pteropus genus. These bats can transmit the virus to humans or other animals, most commonly pigs. Pteropus bats are widely distributed across South and Southeast Asia, the South Pacific, and Australia, increasing the potential risk of exposure. Humans become infected mainly through direct contact with infected animals, their bodily fluids, or food and drinks contaminated by infected bats. Once infected, a person can also transmit the virus to others through close contact, especially in healthcare or household settings. Because of these transmission routes, health authorities identify several high-risk groups, including people who work with infected pigs, healthcare workers caring for Nipah patients, individuals who consume contaminated food or beverages, people who climb trees or enter areas where infected fruit bats commonly live. The incubation period, the time between exposure and the appearance of symptoms, is usually between 4 and 14 days, according to WHO. However, In some rare cases, infections have been reported months or even years after exposure. These are known as latent or inactive infections. Early symptoms of Nipah infection often include fever, headache, cough, sore throat, breathing difficulties, and vomiting. Because these signs are nonspecific, the disease can easily be mistaken for other common infections. As the illness progresses, patients may develop disorientation, extreme drowsiness, confusion, seizures, coma, and severe inflammation of the brain. Although outbreaks are relatively rare, Nipah is considered extremely dangerous, with a reported fatality rate between 40% and 75%. Currently, there is no approved vaccine or specific antiviral treatment for Nipah virus infection. Medical care focuses on supportive treatment, making prevention and early detection critical. Early diagnosis of Nipah virus infection can be challenging due to the non-specific nature of early symptoms, the CDC stated. However, early identification is crucial to improve survival, prevent transmission, and control outbreaks. The agency also advises healthcare providers to consider Nipah virus infection in patients showing relevant symptoms who have recently traveled to or lived in areas where the virus is known to circulate.